Dear friends, next we have our chief guest, Dr. Sangita Reddy, Joint Managing Director, Apollo Hospitals and President of Federation of Indian Chambers of Commerce and Industries. Reddy really needs no introduction, but still let me do the honors. Dr. Reddy has been the driving force for Apollo's thrust on research, innovation, and healthcare initiatives. She's also the chairperson of Apollo Knowledge, the education vertical of the group, and is a member of the prestigious World Economic Forum's Global Agenda Council on Digital Health, which aims to advance the use, adoption, and measurement of technology in health and healthcare, focusing on digital health. Dr. Reddy has greatly influenced the development of the healthcare information technology industry in India, particularly with the global healthcare IT conferences that she had initiated in 2010. An ardent champion advocating the benefits of a global delivery model through rural hospitals, outreach camps, telemedicine, and other such innovative models, she has always been focused on the need to create healthcare for the future. An influential policy maker and reformist, she's actively engaged with governments and industry bodies on aspects of public health and policy development. She's an acclaimed speaker on global healthcare forums around the world and also heads Apollo Philanthropy, encompassing many initiatives such as Save a Child's Heart initiative. With great pride and pleasure, I invite this global healthcare leader, Indian entrepreneur, and humanitarian, Dr. Sangita Reddy, to share her invaluable insights and wisdom with us on technology and healthcare, role of telemedicine in near future. Over to you, ma'am.
Good evening, ladies and gentlemen. It's a pleasure and namaste. I want to begin by congratulating the organizers for the tremendous, effort it must have taken to create this, kind of a conference in the midst of everything else that all of you are doing, considering the COVID. So let me, first say congratulations for this, but in this very same breath, let me also congratulate you for the very existence of your organization, the ideology of quality, of sharing, of being together to help the entire healthcare system. So each one of these are very positive messages. I thought that what I would do is, while talking about telemedicine, share a few slides just to give a real live example of some of the things that we did during COVID and we are doing. So I'm going to try and share my screen. Can you see my screen? Yes. Okay.
Yes, we
perfect.
can see.
Okay. So that's perfect. Good. So let's start. I think that, it's just about 6 months since India declared one of the most stringent lockdowns known anywhere across the world. And this step enabled us to ramp up beds, to plan and procure critical material like PPEs or even the testing kits, to enhance testing, to buy ventilators, and most importantly, I think to train medical professionals and society at large on how to fight this pandemic. Whether it was wearing a mask, social distancing, isolation, how to do grocery shopping, everything has transformed. And while India's total COVID cases are are significantly at 5.85 million, luckily out of that 4.76 million have recovered. We're testing over 12 lakh samples a day. And as a credit to the medical community, I think the Indian death rate is only 1.6%. And I think that not just sharing, but, Apollo has done quite a bit of work in this area. But I think this has highlighted the fact that this is what is being called the VUCA world: volatile, uncertain, cloud-enabled or complex, whichever one you want to do, and definitely ambiguous. Because when we were talking in March, we all thought we'd have a vaccine by August. We're talking in August, we're not sure whether we have the vaccine by December or is it going to be February, March. In addition to that, I think one of the biggest aspects is that the world has realized how much healthcare impacts economies at large. But really, in this uncertain future, one thing has clearly emerged, and that is technology is playing a major role, and organizations which are ready are capable of using this technology to the advantage of their patients, their staff, and definitely their own institutions. So moving forward, I think, of course, the Apollo mission, I hope, is something all of you have at some point encountered, but I just want to say that all 70,000 Apollo family members remain committed to this mission that our chairman shared with us almost 37 years ago. And everyone sings truly the same chorus of everything that we do should be for the benefit of humanity. And it was that led us to say in the very beginning, when people were saying, if we take COVID patients, then our other patients will be scared to come. How will we figure this out? So we quickly said that we will create separate blocks, separate wings, but we have to treat COVID, even if we were scared and uncertain, because if we don't do it, then what will our patients do? And with that really began this 360-degree fight where we created a concept called CAHOTECH, which was CAHOTECH means a protective shield. And we really felt and hoped that we could bring a protective shield across society and our patients. At the core of it was the launch. The app actually launched in February. But by March, we realized that, the fact that you could book a doctor's appointment, but more than that, you could do a teleconsult. You could order medicines from home. You could get tests done from home. All those became very, very important. And then we quickly, in about 7 days from the lockdown, we launched the Corona COVID risk scan, which till date, 13.5 million people have taken. And our COVID fight was really prevention. So how do you educate people? It was definitely about finding ways. It was testing, it was quarantine, it was treatment, and it was rehabilitation. And this 360-degree response really took, a few turns, a lot of evolution. But first it was inform, tell the public, tell our patients, tell corporates, tell other nursing homes, try to be a credible methodology for giving this information. And we used a call center, we used our website, we used social media, we used oral communication through our 3,500 pharmacies, which were doing teleconsult. We used social media and our online app. But education also, during this period, we educated 17 lakh people with our quick online education about COVID. Of course, we did the COVID risk scan, which I spoke to you about. And later, about 2 months later, we were able to bring out an education forum in conjunction with, of course, Medvasti was our platform, but with the Critical Care Society of India, where we did how to use ventilators for the first time, which had content, simulation, and a buddy system. So it used all the technologies available. We did the testing, we created fever clinics, we used Stay-I, and why I chose this slide is so that I could show you about Stay-I. So while we committed about 2,500 beds towards the COVID fight, Stay-I was our partnership model where we brought 4,000 hotel rooms, Lemon Tree, Oyo, all these. But we were able to do it with, like a comfortable sense of confidence, because we telemedicine enabled them using the patient's own mobile phone and then a roaming testing device. And so this is one of the most powerful, quickly scalable uses of telemedicine that I wanted to share with all of you. And in the time from which we started, we have actually done over 1 million room nights. And if you take an individual who stays in isolation, that means actually you've protected 3 to 4 or 5 other members of society, because typically an infected patient who doesn't get into isolation will, during the period of time, infect 4 to 5 other people. Of course, they are the super infectors who went ahead and infected up to 30, but this is the average number. So Stay-I was a very powerful use of telemedicine. And of course, 24/7, the online consults. We're currently doing about 2,500 teleconsults on that platform. The final piece, of course, which is the most important and which all of us are here for, which is specialized teams, 2,500 beds, 1,000 of which were ICU. isolated quarantine treatment, appropriate stocking of the consumables, and an EICU service which went outside of our physical facility and helped hospitals, nursing homes, and others who wanted to stay connected to a critical care specialist and have the benefit of the latest updates. I think that the technology enabled us to scale, and that is really my biggest takeaway. That in a country like India, where we all dream of universal coverage and we're committed that everybody should have some access to good healthcare, and with the overlay of Ayushman Bharat, I think telemedicine is going to become one of the most powerful tools to enable it. I'm going to skip this slide on COVID testing and the numbers that we did over here. It's animated, so I need to this thing. But here, the last line is interesting. In that Apollo 24/7 was able to, we had 3.7 million registered users, 12.7 million people who took the risk scan, and 3,200 doctors live who have finished over 125,000 consults. End of the day, I think anything that you do, results and outcomes are the most important. And I'm happy to state, and we shared this in a medical conference where the health minister was with us, and there were hospitals, including AIIMS and everyone, that our mortality rate has been 0.35% for people below 50 years of age. It went up to 1.05% for people who were 70 years of age and above. And the comorbidities are the significant things, and we've all heard about that. But 40% of our patients who we could not save, and we feel very sad about, but they had over 3 comorbidities. Moving on, I think it's very important for all of us to understand and appreciate the fact that COVID is not just about treating during the infection, but we are hearing about the recurrent incidents of cardiomyopathy, of lung disorders, of body pain, which continues. And I think a COVID rehab and post-care is going to become important for all of us to help our patients or people within our care to get back to normal, whether it's a residual condition or controlling the comorbidity or the physical ailment or even the mental trauma of what they've been through. Finally, on the COVID story is really the important thing was education. And today we brought out our 30th update to the Red Book, which is shared with hospitals and nursing homes, and anyone who wants it, it's on our website. We created a member handbook for people. We gave out corporate updates and, of course, social media training to public. But I really want to re-highlight that in a country like India, where the tele-density is so high, the mobile is really becoming one of the big plays. And it is, exciting to be connected onto a mobile platform. These are just some of the numbers and the stats. I want to move on to other aspects of telemedicine, where I think it's very important for us to take an integrated approach to remote care. And Dr. Alex spoke, very eloquently about the devices, about artificial intelligence, about robotics. And I really believe that automation enabled by devices and artificial intelligence are going to change the way we are able to impact patients. And so this has been a journey or, a passion for me for the last 20 years. And from then till date, we've not only, we've connected only about 3,700 devices right now, but I'm really hoping we can scale this much more. We've done over 700,000 teleconsults, and I won't go through each stat, but teleradiology, teleclinics, EICU, condition management are all the representations of the use of telemedicine in an integrated manner. Because just a video consult, just sending a report on WhatsApp and is not telemedicine. And I really want to highlight that we need standards, we need quality, we need an integrated system. And the day when you don't have to differentiate telemedicine from routine healthcare, and a doctor moves seamlessly between his physical consult and his teleconsults, that's the day the telemedicine has really arrived. So that's the dream and the vision and the passion with which we are working towards this. The Apollo EICU, which gives 24/7 connectivity to an intensivist, to the device, to the monitors, to a camera. Just pulling out one data point, till date, we believe we have been able to prevent about over 5,000 adverse events. And that's because the clinical protocols and the training are all embedded. And we're using this to connect super specialty hospitals, which are not Apollo, but outside our thing, to connect teaching hospitals, to connect nursing homes, and to connect rural institutions. So this is a great future. This is something that we're just working on. We have a pilot which is kind of finalized, where the connected room will not only do Alexa, call the nurse, or Alexa, I need water, so don't disturb the nurse, because we have studied that 47% of the time nurses are called for things which are not nursing duty related. So it connects that. It has the handrail sensors to look at motion and make sure that the patient falls can be reduced. The wireless connectivity is the most important one, where you can measure vitals, blood glucose, etc., so that the nurse can minimize the time doing routine tasks. And this continuous monitoring gets automatically updated into the hospital information system, and you can see it on the record. So we're just piloting this one, and I'm really looking forward to the value addition that this can make to clinical care on a daily basis. But really rethinking outside the hospital, and this is, I think, my last slide, is that I think telemedicine has enabled us to open up our minds. Like all of you decided to do this conference virtual when you knew you couldn't get into a hotel room or a convention hall. We can now think completely outside the hospital where we can deliver care. And then I said, it's not just about Apollo. Let's think outside Apollo Hospital. And then it's not just Apollo Hospital or private hospitals, it's the entire public and private health system. Thinking of a SMAC-enabled world. Imagine if we connected the community health centers, the primary healthcare centers, the common service centers, and gave tele-advice, telemedicine, had connected devices, could do health education. I think this would be transformational for the country, not just in terms of high-end care. And I think Indian hospitals do a fantastic job at high-end care. It's time for us to parallelly look at primary healthcare. I'm working with about 450, or our team actually is working with about 450 primary healthcare centers. This is a not-for-profit initiative. But I'm seeing that if you do it right, then you can bring down the burden of disease. And that should be one of our important goals: universal health coverage, reduced burden of disease, high quality care at the lowest possible cost. And technology and telemedicine are going to be significant enablers of this new world, where point of care testing, personal health records, virtual consults, chatbots, devices, voice recognition, artificial intelligence will all merge to create this new future of healthcare. And I look forward to all of us together becoming a part of it, so that collectively we can build a better world where a continuum of care enables us to connect with a government hospital or a standalone GP and give this in a universal care. So if you're doing an advanced surgery, you send the patient back with a beautiful record, which is hosted in their personal health record, which the GP or the primary healthcare center can see. And there is a genuine continuity of care. And then the next step will be that we proactively approach the patient and the care environment, so that we treat them even before they are sick. And that's what the AI and ML models will do when we put them on top of the teleconsults and the data that we have. The clinical proposition is strong. The adoption framework is getting even more powerful, which is also, COVID has been an inflection point. And I think finally, just there are multiple models that we've been doing, whether it's in cardiovascular risk modeling or in antibiotic stewardship. And I'm happy to share any one of these, because I believe the more of us who come together and the more data we can put behind these models, India can show a way to the world in terms of how we can do proactive healthcare and enable the highest quality of care, even if it's a fresh physician or a young nurse or a healthcare worker handling that appropriate level of care. And since the burden of disease is so high and 1.3 billion people need to be taken care of, the time is now for us to come together We often say that among all the work we've done and all the awards or recognitions we've got, the recognition by Mother Teresa is the one that we love the most, because it reiterated the fact that we are in the service of mankind and that it is God's grace that gives us the strength to move forward. So with this, let me wish all of you the very best in this continuing journey of committing to preserve that which is priceless, which is human life. Thank you very much and all the best to you.